We're staying, I mean, can we go after this?
We're live, Madam Chair.
Thank you very much. So welcome to this meeting of the Healthcare and Wellbeing Scrutiny Committee being held on Monday, the 23rd of January 2023. I'm Councillor Elizabeth Swinglehurst and Chair this committee. We have some notices to go through. Fire and emergency evacuation. For those present in the meeting room, if the fire alarm sounds, please leave the building by the nearest exit and make your way to the fire assembly point in the car park. Papers and recording. The agenda, papers and other relevant information for this meeting are available for public viewing on the Herefordshire Council website. The Council is streaming this meeting live on the Herefordshire Council YouTube channel and is making a recording. To ensure that recording quality is maintained, please speak as clearly as possible and keep background noise to a minimum. Please ensure that mobile phones and other devices are turned to silent. Others are permitted to film, photograph and record public meetings, providing that it does not disrupt the business of the meeting. But I note we have no members of the public present at this meeting. Only committee members present in the meeting may vote. We have a number of people in attendance as virtual participants. Can I request that they use the raise hand function within the system to contribute and introduce themselves when called upon. So, with receiving apologies for absence. We have apologies for absence from Councillor Peter Ginman, and I'm sure the committee will wish to join me in wishing him all the best. Are there any other apologies?
Not from the British Chair, but Councillor Tom B. also speaking.
Okay, thank you. We don't have a named substitute for Councillor Ginman, no?
No,
Okay.
Chair.
No named substitute. Declarations of interest. Do any members wish to declare any interest in any agenda item? Right, so I generally 4 minutes of the meeting held on Friday, the 25th of November. The minutes document of the meeting held on 25th November is included in the agenda. No matters of accuracy have been notified to the monitoring officer. Are you content that I sign the minutes as an accurate record?
Mm-hmm.
Can we have a show of hands, please? Thank you. Councillor Young abstaining. Thank you. So we have a couple of matters arising from that. We requested briefing notes on the dementia provision and Herefordshire minor injury units. Those briefing notes have been circulated to committee members recently on Friday. I'd like to thank Hilary Hall, Corporate Director, Community Wellbeing, and Jay Brooks, Director, Operations and Delivery, NHS Herefordshire, for coordinating those updates. And can I invite the clerk to publish the briefing notes as part of the minutes? Thank you. Also referenced in the minutes, agenda page 14, the Task and Finish Group report on the impact of the intensive poultry industry on human health and wellbeing was submitted to Cabinet on the 12th of January 2023. And I would like to thank Councillor Felicity Norman for presenting the item to Cabinet on behalf of this Scrutiny Committee. I was unable to attend that meeting. Thank you. And so that's the minutes. Okay, so questions from members of the public. No questions have been received from members of the public on this occasion. And agenda item 6, questions from members of the council. No questions have been received from councillors, which moves us on to the substantive part of the agenda. Agenda item 7, the joint local health and wellbeing strategy update. And before we go into this, if I could ask all those officers present, if you could be so kind to introduce yourselves, starting at the far end, and sort of how you fit in. Thank you.
Hi, I'm Kelly Watts. I'm the Talk Community Digital and Engagement Lead.
I'm Emily Lowe, Talk Community Development Lead.
Mandy Appleby, Service Director, Social Care Delivery.
I'm Amy Pitt, Service Director for Communities.
Hilary Hall, Corporate Director, Community Wellbeing.
Councillor Pauline Crockett, Health and Adult Wellbeing.
Mary Noah, Public Health Programme Manager.
Matt Pearce, Director of Public Health.
Thank you. And so can I invite Councillor Pauline Crockett, Cabinet Member, Health and Adult Wellbeing and Chairperson of the Health and Wellbeing Board, to make an opening statement.
Thank you, Chair. Well, today we're going to bring you the review of the consultation process and responses received to this really important joint local health and wellbeing strategy. It's been a huge piece of work, and obviously I want to thank Matt, who has been leading this, and Mary, who has been not far behind him. We have an amazing public health team that are really working hard to get the best for the residents of this county. So I think without further ado, we'll hand over to, is it Matt, are you going to do this, or is it Mary? Double act.
I'm happy to cover off, Chair. So I think you obviously have the report within your papers. The last time we came to this committee, we gave you a brief update in terms of the progress against the existing strategy and our plans going out for the public consultation. So the paper in front of you just gives a very high level summary in terms of the findings from that public consultation. The next steps with that public consultation will be going to the Health and Wellbeing Board, and we actually have a workshop this afternoon where they'll be discussing the findings of that public consultation and deciding what will be the priorities for the health and wellbeing strategy for the next 10 years. I'm happy to hand over to my colleague Mary. I think we've also got some colleagues online from Impact Consultancy who also supported us with that public engagement. So we're happy to give some high level an overview of the outcomes of that consultation if the committee would, or equally happy to have some consultation, some questions. Sorry.
Thank you. Yeah, I think so. A high level summary would be useful, and then I'll go to committee for comments. Thank you.
So the public consultation had two parts to it. First was the online survey, which ran from the 31st of October to the 18th of December. And you've got some results there that you can see, but I'll just go through the headlines for you, really. So we were consulting on 12 priorities, asking people to rate them in terms of very importance, fairly important, not so important, and then we asked them to prioritise their top 3. And the results, the headline results that we got was that we had 960 responses altogether, which is not bad for a survey of this kind, and for the length of time that it was running for. 77% were female that responded. 41% were aged 45 to 64, so that was the majority of respondents. Little representation from the 16 to 24 year age group, only 4%, and 6% were 75 plus, again, as you might expect, because they tend not to be the people that are using online. 95% were identified as British, and 22% were identified themselves as having a disability or long-term illness or health problem. And the majority of our respondents were from our quintiles 2 and 5, 1 being our most deprived, according to the indices of multiple deprivation. And the top 3 priorities, as you can see there, were every child has the best start in life. So that was 63% vote. Secondly, supporting good mental well-being, 52%. And then coming up third, though some way behind, was protecting our natural environment, 31%. And with all the rankings of each priority, you can see there that, again, every child has the best start in life. Got 88% rated it very important. Followed again by supporting good mental well-being. And then the others, as you can see, followed progressively down. We put them in order there. After the 12 questions about how do you rank this priority, we also asked them some more open questions. So some of the qualitative data, the common themes that emerged from our questions was some improvement and criticisms of various health or social services, and you're probably not very surprised to hear that. Better, easier access to community wellbeing, leisure and active travel resources and activities. That we should invest in prevention, encouraging healthy lifestyles. That people want to see more support for schools, children and families. The need to tackle inequalities across geographical areas and the digital exclusion. The need for improvements to public transport services, road infrastructure, cycle paths, to tackle, provide more support to mitigate cost of living crises and support the economy and jobs, tackle environmental problems, promoting sustainability, air and water quality, fly tipping, littering, more help for older people, an ageing population, as we know, more support for women, including during maternity, menopause, and to stop domestic abuse. So that's the headline sort of results coming out of the online survey. And then we had, running alongside that, we had some face-to-face engagement sessions being done with various groups in the community, which was run by Impact Consultancy. So I'll just go through that as well. So you can see a list there of the community lists that community groups that that Impact engaged with. So there's quite a variety there in terms of age groups. We had sixth form college, but we also had Age UK, and we had refugee groups, veterans, Gypsy and Roma travellers, the LGBTQ+ groups. So quite a breadth of representation there. And again, across all groups, really, the results were that I'm sure every child has the best start in life came out top again. And also good mental health was up there in their priorities, but also slightly different with the face-to-face groups was that they were concerned about housing quality and reducing homelessness. So that was a little bit of a difference between that and the online survey. And when it came to the top 3 priorities that were analysed, we found that supporting good mental health throughout the lifetime, with every child has the best start in life, and then reducing loneliness and social isolation. So those were the top 3 priorities for these face-to-face groups. So again, some common themes that came out of these discussions, again, was about access to health services, to particularly GPs, dentists, access to information as well. So, people thought the talk community was a great idea and things like that, but sometimes they didn't know what was going on, didn't know what was out there to help them. Transport needed to be better. Community safety came out as another area of concern. Again, supporting people through the cost of living crisis, childcare, and then a stronger focus on preventative services. So that's about summary really of between the online survey and the face-to-face engagement. So
Thank you.
thank you.
Thanks very much, Mary. Yeah, it's really striking that the consistency across the 2 areas of consultation in the top priority areas, and these were entirely different people. There's no crossover. We don't get people online who then turn up face to face as well.
I would say no on the whole. Or when we did the engagement sessions, we did point them to the online survey if they'd like to do it. But I would say, and I went to most of the the sessions with impact, I would say that they were people that would not be doing the online survey, yes.
Okay, no, it's interesting. I mean, it's also somewhat curious in the ranking of priorities in the face-to-face. You've got every child has the best start in life as number 2, is very consistent with my ranking, but right at the bottom is improved education outcomes for disadvantaged children and young people, which is a curious mismatch to me.
That's a community partnership workshop, isn't it, that one? Which is out of
the ranking of priorities, which has number 2 is every child has the best start in life, and number 12, improve education outcomes for disadvantaged children and young people.
I think one of the things that people mentioned there was that if you prioritise best start in life for children, that would follow on improving education outcomes would
So you don't need to
follow
prioritise.
on. And I think when it came to sort of really honing down on what was the really crucial ones, the top 3, it kind of squeezed that out, and you know, that's, I think that kind of explains that to some extent.
Mary, could you just explain, is the community partnership workshop yet a third thing? I didn't at 6.4. Could you just explain who that was?
Doesn't pass me to say anything. Want to take it to Sarah or Max?
Yeah, I wonder.
Yeah. We've got a few of them on.
Yeah, which Sarah or Max? Hello. Hello, Sarah and Max.
Hi, good morning, everyone.
Would you like to say something about the community partnership meeting, Sarah and Max? And
yes.
Engagement sessions?
Yeah, I mean, that was a multi-agency partnership meeting, wasn't it? So there were representatives there from a wide range of third sector organisations, and I think health partners as well. So we did a slightly different approach to the facilitated discussions that we'd had with the other groups. So people were able to vote on what they saw as their top 3 priorities. And then we had various other discussions, round tables as well. So the things that are written in the report reflect an overview that came out from that session. But it was very well attended. I think there were about 70 to 80 people there. Was there anything specific about it that you wanted to know? Or?
Well, no, I was just curious about the you know, that they had ranked every child has the best start in life as consistent with the other engagements, but the least important, as it were, in their ranking priorities was improving the education outcomes for disadvantaged children.
I think that is
just seemed odd.
Yeah, I mean, I completely agree with the explanation that Mary gave in relation to that, actually, is in that people were seeing that as part of that every child has the best start in life. So it was kind of, you know, if you're delivering the one, then you are going to deliver the other.
So presumably this is a ranking of priorities from a list of priorities that they could have ranked. So you list a priority that was already included within a priority that you'd listed.
All 12 priorities were presented, and then people were given
listing priorities that you don't have an umbrella priority, which somebody might reasonably say, well, look, that's already covered under that priority, so therefore it squeezes out something that's really important, like improving education outcomes for disadvantaged children.
Yeah, I mean, we didn't unpick that in any great depth at the community partnership meeting, but certainly in all the discussion groups that we had, or the majority of them that we had following that, you know, we did ask people, if you're prioritising every child has a best start in life, why is it that you're kind of not seeing the educational outcomes as being a high priority? And it was, as we've said, because people were seeing the one as feeding into the other. And also, as Mary highlighted, you know, it was just, we were being quite tough on them and saying, pick your top 3. So if they had to pick 3, then they were seeing the education one, well, that must be done because it's every child has best start in life. And then ranking the other, you know, selecting 2 others from there. So, yeah, but the community partnership were definitely presented all 12 priorities. They weren't being
Thanks,
sub-priorities or anything like that.
Thank you. And the other point I would make at this moment is the Appendix 1, the percentages, some of which are individually, begging a lot of questions, but just as a general note, it's really helpful if we have numbers as well as percentages, because otherwise you might just be talking about 3 people. It would just help to contextualise it in terms of numbers and perhaps an average and comparative authority benchmark as well. And this is a point that we've made as a committee on more than one occasion. It's just like really, really helpful to actually understand what these numbers mean if we have more context around them. Okay, so I'm going to go to the committee. Councillor Gandy.
I found this report really, really interesting and very useful, and I think it's quite good that we should have a significant proportion of the people that were asked to complete the survey that came in the main between the working age group, whereas we usually get people over the age of 65 who've probably got nothing. Well, no, I'm saying nothing else to do, but I've got more time available to them to fill in this document. It's unfortunate we haven't got a high percentage of young people, but then I am not surprised this sort of thing doesn't exactly float their boat. I was interested to see under the analysis for the community partnership workshop, the item 8, which was support people to age well, which is something I'm striving to do. And if you look at all of the items that are ranked, most of the items that are ranked in there, they are all really linked to supporting people to age well. Because obviously if you're not lonely and isolated, if you've got access to local services, if you've got healthy food and sustainable food, and you haven't got complex needs, and you are have got decent housing, etc., and then you are more likely to be able to live well as you get older. The issue really is about how you go about trying to do that in certain communities. The couple of points I wanted to make in particular were related to in Appendix 1, the summary of the areas of concern informed by the Public Health Outcomes Framework. I agree with the Chair that it would be very useful. I mean, in some cases you can work out the numbers because it's per 100,000 or whatever, but in some cases you haven't really got any idea. I would like, if it's possible, not just to concentrate on breast screening, but also prostate and bowel, particularly prostate cancer, which I believe is now sort of almost getting to the stage where it's overtaking breast cancer in the number of people being diagnosed, and bowel cancer is now significantly appears to be on the increase. I'm not sure whether you have control over the bowel cancer screening programme, which is obviously done in a different way, but I would have thought certainly the screening for prostate cancer. And also the issue of physical activity amongst children and young people, 49%, which is, I think, for me, a surprisingly high figure. But I don't know what is meant by physically active. Does that mean walking to the bus stop to get the bus? Or does that mean playing a sport? There are all means of physical activity, and I'm not quite sure what was actually is measured by. Thank you.
I'll come back on some of those points. I mean, I think this is really difficult, and I think we acknowledged that in the last committee, that many of these priorities are independent of one another, and I think that's what makes this so difficult. And when we discussed at the last committee the progress of the last strategy, there was lots in there, So what we tried to do is really unpick actually what is really important to people. And one of the conversations we need to now progress is actually, okay, what will that mean to be a priority for the Health and Wellbeing Board? What will that mean in terms of resources, in terms of partnership effort? And that's something we really need to think through. And also, you know, just because it hasn't been identified as a priority, it won't mean that things won't get done. There are still things that need to happen because many of our organisations are mandated to do things, screening being one of them. Your point on screening, absolutely right. I think within that Appendix 1, breast cancer screening is an area where we benchmark poorly, which is why we've included that metric in particular. But absolutely agree, screening generally is really beneficial for population health. With regards to under our influence, that's going to be delegated by NHS England to the Integrated Care Board from April 2024. And obviously in screening is in effect a public health service. So I'm already having conversations with the Integrated Care Board about when that does get delegated down to the local level, how can we increase those screening uptakes, particularly amongst those we know don't take up screening. So it's a really welcome point, but absolutely agree, cancer screening in general is really important. Last point, physical activity. I'll look to others in the room, but I understand in terms of children's physical activity levels, it's an hour a day they should be doing. Again, we could always add that contact in there. For adults, it's 30 minutes 5 times a week.
Thank you.
So Councillor Summers.
Thank you, Chair. This is a good report compared to what we've had in the past, so thank you, Matt and staff and helpers. When you read through this, the same thing comes up time and time again. It came up a long time ago. The main things are communication and prevention. We don't have a good track record with either. We keep saying we're going to improve it, but we don't have a good track record. And I'm hoping that UBLOUD will bring things forward, as you talked to already. So can you tell me what you have in pipeline for prevention and communication? Because they're the two stalwarts. If we don't have that, we have very little. Thank you.
Yeah, that's a big question. I mean, I think half the challenge we've got is what do we mean by prevention? I know there's lots of conversations going on children and young people because of the challenges we've got within children's social care. So prevention is there's 3 different levels I think that we often talk about. It's that primary prevention, which is really upstream before problems even emerge. So there's already great work going on across local authorities when we look at the wider determinants of health in terms of education, the built environment. We talked about active travel for obesity. Those kind of real upstream things that take maybe 20, 30, 40 years to manifest into good outcomes. And then there's secondary prevention, which is really when there's early signs of disease. So often we do things like NHS health checks. So people go to their doctor, they have their cholesterol checked, do they smoke, are they slightly overweight? So that's kind of when problems start to emerge. And we actually know there's some really big value and some quick return on investment for that. And then there's a tertiary prevention, which is when people already have conditions. So lots of people have long-term conditions. We've got an ageing population. So that's when people have conditions that have emerged and we try and mitigate that and prevent further escalation of that. So I guess that's the kind of 3 tiers, and you could apply that across the life course, couldn't you, from children all the way through to middle adulthood to older people. So I couldn't possibly cover everything we're doing, Councillor Summers, around prevention, but there is a lot. I think the focus of this strategy is where do we focus on? But I think you're right, we talk about, we embed prevention in everything. What does that mean? What does that look like? But it has to be kind of embedded within all policy, in my view.
Just an example, 10 years ago, mental health in the 0 to 5s was never talked about hardly. It was way in the background. In the past 5 years, it's now coming to the front, which tells me that we really need to be doing a little bit more work in childcare, etc. A little more training. We need to make sure there's a little more training involved there, because that's where we need to start. Our looked after children's numbers are increasing, and a lot of that stuff could be caught quite early. We have things in place. We're just not getting the information from them. They're not communicating. There's a very scattered. It's like a shotgun effect that goes on, and it just sometimes I wonder how anything gets caught, because as I say, it's a shotgun effect and there's pellets going everywhere. So I think we need to narrow the focus. I'm not sure if that's something you can help with in the future, but that's what I'd like to see. Thank you.
No, you're absolutely right. And I think the next steps, I mean, best start in life from a public health perspective, my own professional perspective, that's absolutely the right way to go. As we're talking about, if you get that right in the early years, the first 1,001 days, you will pay dividends going forward. We know that's where life chances are created, the outcomes are created. So I think the next steps for us will be then focusing on, mental health and best start in life clearly come out really high. Okay, what are we going to do within those specific areas? What does the evidence tell us that works? And where are the gaps within Herefordshire? And I think that would be the next steps once the Health and Wellbeing Board have decided, which is multi-agency, what those priorities are be, and what are those kind of sub-objectives that we're really going to make the difference on, and what we're going to focus on together. Adverse childhood experience is another one I've talked about here, again, which I think is a really important area.
Thank you. Councillor Marsh.
Yes, I think possibly that having the best start in life was misinterpreted, because many people may have thought, well, that was 0 to 18, whereas I suspect, you may have meant it was that first 3 years. And of course, if you think, well, I've covered 0 to 18 already, and you've got all kinds of important things, you will squeeze education out. What I think is really interesting is that the top 3 priorities from the survey mirror the 3 directorates of this county. So there's every child, there's a good mental well-being, which you could say was adults, and protecting the natural environment, which is covered by environment and economy. So yes, my question really is about the appropriate way to treat that, and that's somewhere between, there seem to be 2 not very good ways. One is to put absolutely everyone on the Health and Wellbeing Board, and the other is to just go, oh, well, the others are doing it, and I'm wondering how, because the wider determinants of health are really important. Of course, the Health and Wellbeing Board is focused on that tertiary sector, when someone is already not well. And perhaps it'd be helpful for us to understand if, how much of that strategy is just about the people who are already not well, and how much genuinely is about the other bits, some of which you clearly can signpost out, like, what we provide schools, tick there. And the other issue that is kind of coming up seems to me to be the effect of housing on health with the death of the little boy from damp. And there are indeed some very, yes, I've heard recently about some, difficult conditions in some of our housing. And again, that's not your directorate, but at an operational level, how are we, how, because this is everything, isn't it? How are we going to cut that up and report on it?
Yeah, that's a really, really good point. The discussion we're going to have with the Health and Wellbeing Board this afternoon is, as we started to map how some of those existing priorities are currently being addressed across the county already. So housing, there's a housing strategy, obviously climate change, there's lots of work going on around climate change, and we're also mapping how the governance of those priorities are being addressed as well. So there is a piece of work to do that, I think, a bit further, but you're absolutely right. I don't think we should lose sight of those wider determinants things, and actually, again, they're so interdependable. Like you say, if you're living in a house that isn't warm, that has damp conditions, that's not going to contribute positively to the best start in life, is it? So I think that we all need to think through how do we kind of have oversight of all those other wider determinants, pieces of work, and where does the Health and Wellbeing Board focus? So something about a watching brief, but also how do we collectively add value to other priorities? So there isn't a straightforward answer to your question, but I think it's a point well made in terms of how do we get a kind of overview of all those other pieces of work going on across the county, and making sure we are addressing those key issues such as damp. And I know there's pieces of work going on in social care and housing about how we do that and looking at our housing stock. So again, it's just saying what are we already doing, where are the gaps, and how do we address those, keeping an overview of all the other things.
Yeah, and I think I maybe would like a recommendation that the strategy just explicitly say about which bits are the, which are the tertiary bits, so we can just see, well, is that, 90% of it, well, it probably will be, because, but, that it maps how it will check up on those other things, which, yes, can have a very dramatic impact on mental or physical health.
Councillor Taylor?
Thank you, Chair. I've sort of got two main questions which I'll take separately with your indulgence, because they're kind of aimed at two different sets of people. But just before that, can I just pick up on Councillor Marsh's, sorry Trish, point that about the damp and housing, in the sense that, I mean, I have a ward with a huge amount of social housing in. And in last week, I had two different sets of residents come forward who have had long-standing damp problems in their properties. And I think, as Councillor Marsh refers, I think the recent publicity involving the death of that little boy means that more and more residents who are in those situations, who have been trying to deal with it within the housing association and probably banging their heads against the wall, are now going, I can't sit on this any longer, this has got to be dealt with. So I just think, as a sort of an across-the-board flag, we need to be aware that I think more and more residents will be upping the ante, on, quite rightly, on damp conditions in housing. And I think it's something we should be prepared for. Now, I will start a question. Matt, you referred to, in reply to Councillor Summers, about the prevention side of things, the benefit of people routinely having cholesterol checks and medication checks and blood pressure and so on. However, I think that doesn't sit very comfortably with the current difficulties in general practice. Very recently, at a community event, we had some health professionals doing a routine and completely anonymous survey asking residents, anybody who had long-term conditions that they were being treated for. And by the time they got to me, and she said, and so have you had a routine medication check, etc., in the last 12 months? And I went, no. And she went, and I went, do I take that to mean that's the answer virtually everybody has given? And she went, yeah. She said, but everyone I've spoken to this morning who have got underlying long-term medical conditions have not seen the GP to review their condition, to check their medication. And in some ways, it's not surprising, given the difficulties of getting medical appointments at the moment and the difficulties that general practice is in. But that current situation, the reality, seems to fly in the face of almost your reply, or that element of your reply to Councillor Summers, and suggest that actually in that respect we will be going backward.
Yeah, I mean, that was just one example of prevention. I said I couldn't cover the full span, but I think your point's well made, and I think we know that primary care is under a lot of pressure. But that said, I think there's innovative ways we can look at that. So I know in some parts of the country they deliver NHS health checks in pharmacies, they go to workplaces, they drive vans out into communities. They are restricted in terms of what clinical services they can provide, but actually I think there are innovative ways of looking at that. But I think you make a really valid point, and within the survey, access to local services has to come up. You know, dentistry, primary care, we all know those are under pressure. So there is a conversation about, obviously, with our NHS colleagues, and the Health and Wellbeing Board is one forum for that, isn't it? Because we have them around the table to say, how are we going to support those local services? So absolutely agree with you. I guess it's how we think differently and deliver those preventative services. But just one point, the NHS health checks is one minor prevention. So there's a whole load of other stuff, social care, preventing people going into social care and all sorts of things. But I agree with you to a degree.
And my second question, which may be aimed at the statisticians online, because it's very much a statistician's question. When we met last time, we said how very difficult prioritising these 12 statements were. But all credit to the respondents, and I include myself, we managed to do it with quite a greater spread than I think I would have expected. I'm not going to play devil's advocate here, but I think I am going to play the role of a statistician. It isn't surprising, I think, that every child has a good start, consistently comes out at the top. And I think it's probably what we would have expected, and I think it may have been what I put as number one. However, and this is where the sort of devil's advocate slightly comes in, given that it is consistently high and therefore will consistently influence the priority of this strategy, I just raise the question, statistically speaking, is there any concern that that priority has been influenced by the very considerable and quite proper publicity and concern about children's services in Herefordshire? Very few of the respondents will have failed to have read, heard, seen reports about the Ofsted report and the difficulties that children's services are having. And in doing so, have we almost prejudiced the jury? Have we influenced respondents to either consciously or subconsciously put that at the top of the list? There's no, we don't have the data at that sort of level, or indeed even anecdotal evidence, one way or the other. I just wondered if those who were responsible for collating it, what their feelings are on that, or indeed if there was any evidence one way or the other.
Difficult question to answer, but I'm hoping my impact colleagues, they might have got some qualitative feedback from some of the engagement sessions. So Max, or do you like to come in? Yeah, put your hand up.
Yeah, do you want me to speak first? Just in terms of the groups I spoke to and came across, it wasn't raised very much at all about children's social care. It didn't come up, apart from a couple of young people I spoke to at the sixth form. They talked about their own personal experiences, so obviously that impacted on their response and their views. But otherwise, in terms of the refugees, the Polish community, the veterans, the impact that the press on children's social care didn't come into any of their conversations that we had.
Yeah, that's the same as with the groups that I ran as well, Max. I would say it didn't come up, which I was surprised about actually, because I would have, it has had such prominence in local press that, yeah, you would have expected it to more, but no, it didn't. But that's only the qualitative side, isn't it, rather than the survey side.
Yeah. Okay, thank you. I think it's almost impossible to judge how people are influenced and how it's prioritized. So I have Councillor Gandy, and then I'm going to draw this to a close. Thank you.
Thank you. Yeah, running through the report is a view, and we would probably all agree about the fact that we are a rural county, and therefore it is very difficult for local services to be accessed. Well, they're not that local. Services to be accessed by people living in the rural communities. Our public transport is poor and is getting poorer. I represent a very rural community bordering onto Shropshire and Wales, and I've talked about, going back years now, particularly with regards to dental, about, we offer a mobile service for breast screening, and why do we not offer a sort of service for dental, hearing, ophthalmology, those sort of things. With the best will in the world, it is very difficult if you live in one of my very rural villages and you don't have you don't have a car to get even into Leominster, even if you are able to get a dental surgery that will take you, but it's just almost impossible. And we have a significant number of children who start school, and it is not until they start school that it becomes clear that they either can't hear very well or they can. And if you're going to have a good start in life as a child, you've got to be able to see and you've got to be able to hear. And I've known for a long time now about the opportunities or a mobile service that could offer that, going around the rural communities to the school areas. I mean, I've even got in my board a very, very large health centre, goodness knows, I suspect it was built under the times of GP fund holding, but it's an enormous building. It is not used, I don't believe, to its full capacity by any means. It's almost opposite a primary school, and I'm thinking, why on earth is this building not used for those sort of screening opportunities for the children in that school? So I just wonder what your views are on, we've talked about it probably 3-4 years ago about possibly doing something with regards to dental, but also with regards to ophthalmology and hearing.
I think you're right. I think one of the things we want to look at in this strategy and what we need to agree on is some almost not principles but overarching themes, and I think access will be an overarching theme. So whatever the priorities will be, I think access has to run through all of that, as well inequalities, those kind of things. So again, a lot of things you've talked about are within the gift of our NHS colleagues. So obviously we, again, Health Wellbeing will have that opportunity to have those discussions. I think there is an opportunity, the other one's speech. We know that's fundamental to good health outcomes as well. So speech, audiology and sight. We are due to recommission our health visiting and school nursing service soon. So I think there's an opportunity as we look at that whole pathway to have conversations with our health colleagues. Actually, could we think about a different way of delivering some of these services? I think the challenge is making it cost effective and delivering good outcomes, and that's always a challenge we've got, balancing some of these. But I don't know if any other colleagues around the table want to add, but I agree, it's something we need to look at about how we deliver different models of care. But it's not straightforward, it's not easy, because it is around cost, isn't it? And cost effectiveness.
Thank you.
I agree it's about cost, but there's nothing more worse than a child going through school not being able to hear or not being able to see properly and nobody picking that up. And if we see that as a priority, I recognise there's cost involved, but the cost to the child of not picking that up is enormous.
Yeah, and again, I agree, and I think it's best start to life. That's an area we can focus on. And I'm not familiar with what our current provision is around those services, but again, happy to look into it.
So I'm just going to remind everyone, actually, with what we're doing here at the moment is looking at the update on the progress of the Health and Wellbeing Board strategy. So we've had a very wide-ranging debate to focus in on if we have a specific suggestion, there won't be a recommendation unless it's to the executive, and principally because it is about the Health and Wellbeing Board strategy, it would be a suggestion to the Health and Wellbeing Board, which we would pass via the people present who are on the Health and Wellbeing Board, about the way in which we feel that strategy might be influenced by what we're doing here today. But this is not really, we will be here forever if we start talking about the ways in which we think we should improve service delivery.
But it is one of the challenges identified by the community partnership.
If you want to draft a suggestion for the Health Wellbeing Board to consider in their deliberations on the strategy, then that would be fine. We can put that in that observations and suggestions which is the agenda. Okay. Right. Do attending cabinet members, council officers or other participants wish to make any further comments at this point? Thank you very much. So the covering report recommends that the committee considers the report and makes progress, and we do have some additional items to add into suggestions and observations, which I think we're going to be looking at now, and hopefully that will also include the observation about data presentation within the report, which in other respects I think is a very good report, and I'm very grateful for the clarity within it.
That's a recommendation, please. Maynard Orchards is being classed as our social direction. What if the Health and Wellbeing Board can look at what's available there that we can use in health and wellbeing? So there is space in the back of Maynard Orchards that could be utilised probably somewhere along for health and wellbeing. I'm not sure what, that's not my forte, but it is something maybe they could look at, because it's wasted space at the moment.
Okay, this is a suggestion for the health and wellbeing strategy.
Yeah.
as a result of this
Yeah.
report, and consultations in the report.
Yeah, because
So,
obviously
do you want to-
communications is an issue.
Okay, if you want to write that down, or.
Okay. Not very good at writing down, but, you know, anyway, it's just something that I think that, I don't know what the cabinet member would think of that, but there's a few things that,
Well, perhaps we just leave it within the debate as a suggestion that the cabinet member can take away and consider after the meeting. That's okay. Good, thank you. Councillor Gandy, do you want to formalise children getting best start in life?
I just think that once again, that we should look at some form of mobile service across the county that will provide a good start for children in their life with regards to various issues, including sight, hearing, dental, speech therapy. But we've been there before, so it's probably not going to go anywhere.
No harm in raising it. And I think they probably say would be through the screening, enhanced screening offer once that comes through. But I suspect we'll probably get that on the agenda. Did you say 2024 that's going to come?
Yeah, 2024.
Yeah. I think that was something that we would like to have a discussion about when that time comes, as the way in which those services can reach rural areas.
Yeah, I mean, you know, that's not to say we can't have a conversation with NHS England now. That's just when the services transfer over to the integrated care board.
Okay, so perhaps would it be appropriate to put that as an observation, suggestion?
I think you're more than welcome to.
Take that on screening.
Chair, I think the committee got very excited at the thought of maths workshop this afternoon, so I think that sort of opened the
That's very understandable, but we have got other.
Absolutely.
Right, so we're getting some stuff coming up on screen now, you can all see that.
Okay, so we've had three suggestions. The health strategy presents clearly how the priorities covered by other directorates, brackets health partners and boards, will be monitored and promoted. Clarity is provided about the proportion of the strategy that is focused on primary, secondary and tertiary prevention, and considerations are given to providing mobile outreach services such as dental care, screening, etc., to ensure all children can be provided with the best possible start in life.
Do the commission members want to say anything else? We're happy with that? No? Cabinet member, council officers, do you have any further comment on those suggestions? Councillor Crockett.
Thank you, Chair. I don't think any of us disagree with that. Wouldn't it be wonderful if we had the finance and the facilities to do it all? But we have to narrow it down. There is no infinite amount of money, etc. So I thank you all for your debate this morning, and we will strive to suggestions.
Thank you, Councillor Crockett. So can I have a proposer and seconder for the outcome of these suggestions? So Councillor Marsh and the seconder. Councillor Tillett.
Oh, sorry,
All in favour? Any against? It's unanimous. Thank you very much.
Didn't see anything up there about mental health.
So, Councillor Summers, if you want to make a recommendation.
Well, it's an open recommendation, you know, it should be almost mentioned every time. It's
It is,
on the top three.
But Councillor Summers, the actual agenda item was health and wellbeing strategy,
And mental health.
the consultation responses which prioritise mental health in the top three in every conceivable element of consultation. I don't think we need to say more about them. We have remarked upon it, the importance that the public place upon that. I think that's
Thank you, Chair.
sufficient. And I know you will always raise it, you're a great champion for it. Thank you, Councillor Summers. Okay, so agenda item 8. So can I invite Councillor Crockett, Cabinet Member Health and Adult Wellbeing, to make an opening statement in terms of access to council wellbeing services. And I'll also invite Councillor Ange Tyler, Cabinet Member Housing, Regulatory Services and Community, to make an opening statement in terms of talk community. First of all, Councillor Crockett.
Thank you, Madam Chair. I think we all know that in the last 12 months we have really taken off with our signposting and accessibility services, and that is continuing to blossom. I don't know whether my director would like to add anything, but Councillor Tyler has been heavily involved in Talk Community, and again that programme is forever expanding, and I think we've really got to push with this because it is a resource that we need to use more and more. There is some funding out there, and I don't know whether Amy Pitt would like to talk about that funding that we may be able to utilise to support this Talk Community programme. But again, there's an awful lot going on. This is just really an overview of what's been happening, how we're doing it, and if you've got any comments or suggestions that we can take forward, we most welcome them.
Thank you very much, Councillor Crockett. And Councillor Tyler online.
Thank you. Yes, I welcome the report. I'm very passionate about our Talk Community programme, and the more we can do to engage with other local partners and community groups, especially through social prescribing, can only benefit our hubs and our expansion in the next 2 to 3 years. It's really important that we grasp the hubs and make sure people are connecting and involved in the community. Then we can support and find out if there are any problems in the community. So I will visit to the officers to put more detail for you. Thank you.
Thank you much, Councillor Tyler. Thank you. Right, I think we're going to go straight into debate, but you know, officers, please to be expansive in your answers. I think it'd be better if it was a sort of dynamic discussion, and this is not the first time that we looked at Talk Community, which is something that we're all very passionate about. So I'll start with Councillor Summers.
I just want to raise something that's been all over the news this morning. It's happening in Worcester, but I'm a little concerned about what's happening in Herefordshire, and that's housing, social housing, and how much do we have to do with Connexus, for example. I know one Connexus property last year that the man got COVID, but his house, when I went over to check, it was it's unbelievable what it was like. I'm just wondering how much input we have with Connexus and how. And I believe you know about that one, Amy, that time, quite some time ago. But how much do we have to do with Connexus and social housing? Thank you.
Possibly Councillor Tyler.
The question, that's something I can go and talk to with Connexus, and I can come back with a written answer for you.
Thank you. So just as a general note about housing, and this might be something that we take as a separate scrutiny at some point, but housing, social housing can have issues with that.
Major issues.
But also every other kind of housing can, you know, and the health impacts are the same, whether it's, you know, social housing or any other kind of housing. And maybe there is a broader discussion to be had around housing and health impacts, which perhaps we will discuss when we get to the work programme.
Yeah, the news from Worcester, the news from Worcester this morning is terrifying about some of the things that are going on there. So yeah, it's something we should probably look at. Thank you.
Councillor Kennedy.
Thank you. Talk community hubs, very important, and I fully support them. I looked at the list of hubs that there are down here, which are the 67 of them. naturally, the vast majority are in the market towns, and 26 of them are in Hereford itself. My big, and it's difficult because I don't know the whole of Herefordshire, so I don't know in some cases whether these some of these are in very rural areas or whether they're actually quite close to the market towns. But certainly I thought some of the east, I thought there probably weren't any more than about 3 that were in the villages, and similarly with the northwest, about 6, and 2 of those are in my ward, and one of those is difficult. I would struggle to call it at the present moment a talk community hub. But the thing that concerns me, and I think Councillor Tyler touched on it really, of the 67 hubs we've got, we're saying that approximately 300 people a week attend, which is about 4 a week per hub. Now, some of these hubs will obviously attract significantly more. I mean, I know from some of the ones in Hereford City, there are significantly more. So some of these hubs aren't attracting anybody at all. And that is very, very worrying. It's not just worrying from the point of view that we're counting it as a hub, but it's actually not doing anything. But we've recruited very willing volunteers who are sitting there having a nice chat and a cup of tea, but not actually doing anything to support their community, and that's not their fault. I do know from my own village, which is not in my ward, that we don't have a talk community hub, but we do have a good neighbour scheme, which does a sort of a job, but it's not a signposting system. So I'm a little concerned that we have got what we call 67 hubs, but we're only actually catering, as the figures show, for 4 people per week in each hub. And I think for the time and the money involved in this, that isn't really what I would call good value for money, and it isn't really doing what we want it to do. And I'd like to know what we're trying to do to encourage more people to actually go to these hubs, and why we think it is that people aren't, because they obviously aren't, and the figures speak for themselves, really.
Sorry, yeah, of course, yeah. So thank you for the comment. I think, and actually since the report, we've now got 69 talk community hubs.
We've got even less, but
I'll respond on that. And I think what's in the report, and what we are trying to do is obviously work with the community organisations to understand how many people are attending. I think where this is slightly different to any other commission relationship, this is a completely different relationship that we have with communities than what we would a commissioned organisation. So requesting the information and receiving that information is often very difficult because they are volunteer led, and sometimes they don't often catch how many people are coming through the door because they are working with people. So the report says, and it's only about 70% of the hubs at that time, back in sort of October when we got the data, actually responded to us in terms of the number of people who are coming through the doors. So it's sort of, it is an evolving and transitional process that we're going through, but notwithstanding, we do recognise that some of these hubs are far more utilised than what other hubs are, based on potentially where the location is, or actually sometimes down to who the community leader is and who's really involved with that to get the information out in terms of those hubs. So and the plan is at the moment is absolutely to consolidate the hubs at the moment, to see how we can work with the hubs to understand the needs in those communities to provide support to the volunteers in terms of meeting some of those needs, and also trying to support people to come through the door and recognising that we want people that it's there to use as and when. In terms of value for money, I think what I'd say is, some of these hubs, the maximum grant that we give them is £2,500 at the time that they sort of become involved with us from with Talk Community. So it's pretty minimal spend in terms of what we spent on the Talk Community hubs over a period of time. And the plan is, like I say, to consolidate them now, not to sort of try and get as many numbers through the door, but actually consolidate them to see actually where do we need them, where are the gaps, and how can we work with them to expand if they want to, because obviously it's based on what they want and what's needed in the community, and see if there's any sort of support we can provide. What I will say is, obviously, as part of the whole programme of Talk Community, is that we're trying to ensure that the population and residents all know about Talk Community, whether it's the hubs or whether it's the website or the directory. And you'll also see on the report that actually we've seen a huge increase in the number of people accessing our information, advice and signposting online. So for me, it's around it's the engagement of the whole Talk Community. The hubs is an enabler for Talk Community, but it's how we sort of continuously get the message out around Talk Community, so we sit across all of our population in Hereford, and obviously, like I say, the hubs is part of that. But yeah, we've also got Talk Community Development Officers in each of the primary care network, and they will be working and should be working with the hubs to talk to them about, how we can maybe get more people through the door, how we can engage with more people, etc. But part of our role, absolutely, is making sure that people are fully aware of what's available through Talk Community and these hubs and that offer. But welcome comments from the committee in terms of how we can improve that as well.
So I recognise that the amount of money that you give to each hub is relatively small, but then on top of that you have got the cost of the people that are the officers that are sort of working with these hubs, and I just am concerned that some hubs have been set up because it's thought it would be a good idea to have a hub in that area, but the people who are actually volunteering to run the hub don't actually really know what they're supposed to be doing, and they do it alongside another part of the voluntary work within that building, but they're not really. I wouldn't call them a Talk Community hub. I would just see it as a service that's already there, that's providing a bit of signposting on top of that, which they would have done probably anyway without being called a Talk Community hub, and without £2,500, and without any, and we wouldn't be necessarily including them in the numbers. I just have a concern about this, that the idea is really good, absolutely really good, but I just think the actual delivery outside of the I can't speak for the market towns and city because I don't know anything about those, but certainly in my own area, I don't see the value of them at the present moment in time, and that worries me.
Yeah. If I could add something from a social care delivery perspective, but of really looking at the future and how we're trying to gain from the social care teams into the community, into the primary care networks. We see the hubs as a real stepping stone for us to be able to do that. Not every hub, we haven't got enough social workers to split out into every hub, but part of that work with Amy and her team is looking at where that footfall is or where it really needs to be developed, linking up with our health partners and prevention partners and community partners, taking that conversation forward so that we actually have we have that visible, we are there visible in the community, rather like social care used to be, delivery, but of course COVID put paid to quite a lot of that, but we think that that's rather, you were talking about mobile answers, but I think personally community hubs are part of that answer as well, but we need to be really developing those local intelligence and ability to get into those hubs. Some of them are too small to offer a place for, say, clinical work, or but others actually do lend itself to that. So I think that's part of what we're hoping to put into the report that would help you see what the vision is.
And I think, for me, in a sense, we can't do everything. The strengths-based approach necessitates creative solutions that work in a rural setting. And this is part of that, and it's evolving. I think it's, and I know what else would we be doing? It seems to me it's the right thing, but we have to allow it to evolve and to strengthen and to get deeper roots. So let's have faith. I was looking at the title of the report, Overview of Signposting and Accessibility to Services, which is a lot kind of bigger than Talk Community as a subject. And I was considering what did I think the likely range of obstacles are to the accessibility to services. So so there's clearly there's a geographical problem that we're very familiar with in Herefordshire, to physically get yourself to where there's some services. And there's the information signposting, which there's a lot of information about in the report. Grateful for that, thank you. But then there's also depression. If an individual is depressed, they're not going to access services because they're going to struggle to get out of their front door. So I was thinking a step away from this and actually thinking, what do we mean when we're asking about accessibility of services? It's not just signposting, it's all the other reasons that somebody's not going to access services. It may be that they're on their own and that they'd love to go to the the choir to strengthen your lung capacity, but they can't get out of the front door because they've got no one to go with and they don't want to be on their own. Blah, blah, blah. So these obstacles that sit really that they are a tremendous problem for accessibility, is because that the individual needs support to make that first step and to join that group and to become part of a wider network. And so these are the sorts of issues that Talk Community Hubs and Talk Community generally could address if we were clear about what it is that we're asking them to do. So particularly if there's someone on their own, whatever, that they know to actually go and knock on the door. That person's not going to go to the village hall for the old person's lunch or whatever, because they're just not. They're going to need to be encouraged and supported. And then once they've done it a couple of times, they'll probably get the hang of it. Transport. We were hoping to have community transport here today, but again, sort of that area. So those are the sorts of things. So do we feel that Talk Community and Talk Community Hubs and the approach that we're taking will address those sorts of obstacles to accessibility of services? And then the other thing I was going to say is in the previous report, the Appendix 3, access to services, challenges, access to services. But the feedback is waiting lists, access to mental health services, GPs, pharmacies and dentists. So these are all access to services in the sort of capital S services, if you like, healthcare services. So some response on those points really. So the Talk Community end.
Yeah, so I suppose, absolutely, through the range of offer that we're trying to provide through Talk Communities, to be able to reach into, all communities, whether people are just on the verge and just needing support, or maybe, or unfortunately, if they do need that sort of those critical services. So the idea of Talk Community is, doing it very much at that micro level, working with community organisations to build them, so maybe people have got the. It can be enabled then to go and reach out to those people who are really hard to reach. I mean, unless this has always been a really difficult area for us in terms of how do we find those hard to reach people. And sometimes it's just that those families potentially are just about managing as well. How do we find them? How do we encourage them to participate and be involved with these? So to be able to offer a range of services and through Talk Community at that micro community level, it's absolutely what Talk Community is about. And to encourage that through the volunteers. But obviously, a lot of this is volunteer-led as well, so we are reliant on people giving their time to do this work. So yeah, I mean, and then one of the other things is what we're considering, also just sort of touched on around the hubs before, is working with the hubs now going forward is, do they want to particularly specialise in an area? So could it be loneliness or dementia or domestic abuse or poverty or things like that they feel that the needs are in that community? So as a local authority or agencies, we can support those volunteers to be trained up further potentially in those areas, to enable to them to reach out into their community based on what they think their community it's needed. I think, as you quite rightly said, you know, in terms of this whole evolving, the talk community is evolving still and developing. Having this complete community paradigm shift takes a lot of time and a lot of, you know, things that we need to do and to put in place. Yeah, I mean, the whole ethos of talk community is how do we reach out into those communities at a very micro level to support people to stay in their communities for as long as they can, to stay well as long as they possibly can.
Can somebody comment on access to services in terms of waiting lists, access to mental health services, GPs, pharmacies and dentists, as noted in Appendix 3 of the previous report?
By the looks of it.
I mean, I think this is broadly healthcare as opposed to social care. So, yeah, anyway.
I'm not sure I've got the answer, Chair. I mean, you're right, they are broadly health services where we're seeing the bigger waiting list. Though obviously we have got waiting lists in social care as well. I think one of the bigger issues for all of our services is around recruitment. So capacity is, often waiting lists are down to capacity, and we're all struggling with that. And you were at the Scrutiny Management Board where I talked that for us it's a real major strand of our transformation strategy is around recruitment and retention, really being clear what the offer is in Herefordshire. And that's not just for our services, that's across the piece. How we describe it, how we attract people, recognising that in some of these areas as well, there are national shortages in terms of skills and capacity. I think, you know, picking up on the point that was made earlier, looking at different ways of delivering services as well. It has got to be part of what we do as well. So we might have always delivered something in a particular way. Actually, are there other ways that we can look, perhaps using a different skills mix? You know, those are the things I think we have to explore the art of the possible to address some of this, because just saying we haven't got enough social workers, enough dentists, we're merely restating the problem. Some of this is about how do we actually come up with some of those different solutions. I'm not saying that those are going to be easy, but I think it has to be part of our consideration, because we can't just magic people into some of these roles.
Yeah, thank you. So it is, you know, it connects, doesn't it? That creativity. So Councillor Marsh, and then Councillor Summers, and Councillor Taylor.
Yes, I'm interested to hear that you're now sort of going into the consolidation phase for the hubs, and I entirely support the idea of using the strengths that are there and the voluntary, you know, integrating it. And I know it's very difficult because you can't tell people to do things, but it does seem to me that there needs to be perhaps two levels, and one is the hubs that genuinely are, you know, going to be high volume, and there actually might be a person there, and the person might actually understand the website. So, and then there's a whole lot of other people, and it seems to me that anything should. I think that an acid test could be: does this help Carol's Good Neighbour scheme? Because what should happen is that any group of volunteers should be able to go, oh, hang on a minute, I think there's some stuff online, maybe I could give you a hand with that. And so that's because there are lots of people who will never think to look online, and if they do look online, they'll be very easily put off. And you've already got 970 volunteers in your existing hub. So the problem is already so big that it wouldn't matter if we called that 10,000 volunteers and it was all the volunteers. It would be the same answer. How can we upskill those volunteers so they go, ooh, you know, because there's only so many people who will have a look themselves for all the reasons that Councillor Gandy has mentioned, because, you know, feeling trapped, they're on their own and they never understood the internet anyway. So that seems to be something that we need to look at, is getting more, you know, people like WIs, any group of people really to be aware, so that as well as the people themselves, there's a very robust. I mean, I've got a couple of other things, but I don't want to do those now. Shall I do those now? Yes. I do think your graph on page 35 is dreadful. It doesn't explain what the UCL is. It doesn't explain what the LCL is. And on the end of paragraph 8, it appears to be saying, you've lost a bracket, it appears to be saying that 71% of people weren't referred, and that means that that was great. And I'm kind of going, I'm not so sure that that was that great, but I suppose they did get the opportunity to be signposted. And then over the page in 9, it says the above graph shows about knowledgeable social workers, and I'm going, you know, this graph is too much information for a normal person. It wouldn't, you know, to be any help, it needs to be a bit unpacked. And then, yes, it would be nice if your graph on page 40 explained what the orange line was, but it doesn't, you know, it's not a big deal, but it would be good. And then the other group I get quite excited about is self-funders, and you know, we do have an above average number of retired people, but we do also have an above average number of self-funders, and I'm, yes, just very motivated that given all the people we have who, you know, are absolutely, we are their providers, that we do make information available in a timely manner to self-funders so that they can make, you know, well-informed and timely decisions, and don't suddenly end up with us when, truthfully, if 6 months ago someone had gone, you know, had explained that perhaps they could do with a bit of help, but, you know, they, whatever it was wouldn't have happened. So I mean, I've just written down that perhaps a recommendation could be provide advice to self-funders so they can make informed and timely arrangements to protect and prolong their health. And I guess it might be self-funders and their families, because from my experience, the person themselves may have a different view of whether they need some help to those around them. And I know it's not easy, but it does seem it's a large cohort of people, isn't it, in this county, and the more they can sort themselves out, you know, the less trouble they are to us. Doesn't sound right. The better that would be.
Can I provide you a little bit of explanation around the 71% of people on the graph that you were talking about? It is a complex graph. Sorry, it's how we receive it as well. So, but the 71% is out of all the referrals that come in asking for advice and support into our advice and referral team. 71% is the people that don't progress to a full Care Act assessment, but instead are signposted to perhaps to talk community, not necessarily to the hubs, but directly for a community broker offer or a social prescriber offer. And that, I know, is something that we're going to be reviewing, is just exactly how we can improve that access and make sure we've got a good understanding and a proper teamwork approach about that. So we've got lots of opportunities there. Also for OT assessments, it might be through to the domestic violence unit, a whole range of signposting. So that's what that was supposed to say. Sort of 4 or 5 years ago, that would have been, we probably would have been, well, we were progressing many more people to a full assessment, only for them to be then at a later stage diverted out into what they really needed. So that is actually been protecting social work time to be able to spend that on the most vulnerable. And really what that was about was trying to show you where Talk Community is working, but perhaps not from a hub perspective, but from that way direct work within the community's good neighbourhood schemes, but also the cross partnership with health and social care.
Thank you. No, that does sound positive, but because it is such a large number, perhaps from time to time you might take a snapshot of how many people actually took your lovely advice, because 71% is a big number, and it would be nice to know, well, did most of them go, oh, well, that was lovely, but didn't do anything, or how many, you know, how many got in touch, and the ones got in touch, how many got some support. I know you maybe can't do that all the time, but if from time to time you could do at least a snapshot, that would be helpful.
Absolutely, we are taking that very thought forward. We've got our workforce development team currently developing 2 questionnaires which should capture the voice of people that are in contact with our services. One is for people receiving it, but we're also developing a questionnaire for people that have been signposted across, so that we can randomly send these out and work with people to establish if we have met their needs and what their experience of contact with our services is like. So we have got plans in place to launch that.
Maybe we could commend that, or support it in our recommendation, or in our observation, whichever section is the right section, John. I'm not.
We can do a recommendation, but we could certainly just record approval. Councillor Summers.
Thank you, Chair. Volunteers in the patch are an issue, I know. Like, it was great to get more children in, but if you get more children, then you need more people with DPS checks. So there's a whole list of things there that need to be sorted. So that's a difficulty. I noticed that the fire department was a lot of people showed up for that. A lot of people showed up for the community police, but the community police on 2 occasions now have not shown. So I wonder if someone can contact the community police group and ask them why they're not, their excuse is that they get busy. Well, I understand that, but we need more input from community police. I know for 7 years now, getting community police involved, well, they're very transient. They change very, very quickly. You never know who's going to be there. Appointments, and they don't show, and it's a problem. So when the communities make these appointments and tell people they're coming, they get very upset when they don't show, and it makes them look not very good. So if you could do something there, I'd appreciate it. Thank you.
Yes, that's absolutely fine. We meet regularly actually with the police officers in Hereford and to link in how we do link in through talk community and the hubs, etc. So yeah, we can pick that up with them, and also we can send you some information that we've recently received from them around who are the Saferhood neighbourhood teams across the areas in case you have that.
And the other thing is, Amy, I mentioned it before, I cut and paste your newsletters and send them to much as possible to all my parish councils and the community groups. If you could share on that, like on all the council stuff that comes through now, there's a shareable for Facebook on it and shareable for different things. Yeah. If you could do that on it, I know people can get the newsletter, but if I could share it with them rather than go cut and paste everything else, I would really appreciate it. Thank you.
Yeah, absolutely. We can take that, have a look at that, Kenny. Yeah, and take that forward. Yeah, we'll have to.
Thanks.
No problem.
Thank you.
Thank you, Councillor Summers. Councillor
Tillett. Thank you, Chair. Just very briefly, given that Councillor Summers mentioned it early on and Councillor Tyler gave an undertaking to look at it in terms of how much influence or say do we have with Connexus. Can I just say, particularly to Councillor Tyler, I mean, given the nature of my ward, have Connexus casework virtually every week, sometimes more than once a week. I have to go through the housing officers. I've got pretty good relationship with the many housing officers who cover my ward, but it's very inconsistent. And I think in terms of dealing with housing issues, if we could have some sort of consistent way of contacting and dealing with Connexus issues, it would, and this is probably true for the other housing associations as well. I have some housing officers who reply to me very quickly and very helpfully, and others who either don't reply or say, well, I can't really discuss this with you, Kevin. And I understand, one size does not fit all, but I think it's something that if Councillor Tyler is going to look at it, that would be very helpful. Now, talk community, I have been a pain in Amy's side for as long as she's been in post, so she won't be surprised. She knows what I'm going to say. In fact, some of you do, because I say it so often. But I say it with good heart, Amy, because I really do believe in this, and I really want to see it succeed. But I've had concerns from the beginning. I have concerns, some of which Councillor Gandhi has voiced. the report says Talk Community is becoming better known and more routinely used as a route to information. Well, where's the evidence for that? Because if we look then in the report, the proportion of people who use services who find it easy to find information has actually fallen. It hasn't increased, despite Talk Community. It's gone from 70% down to 67.8%. The previous survey in the earlier agenda item again talked about people flagging up access to information being a major problem. Councillor Gandhi rightly flagged up, the average low use. But as Amy knows, that is not restricted just to the rural hubs. I have several hubs in my ward, one of which, even now, still has never yet had a single inquiry for signposting services. Now, I'm not saying that that is solely the fault of Talk Community, but we have a facility there, including hardware, that is just literally not being used, not being switched on. And why is the answer? On the sort of flip side is that many of the activities that are listed in the report, which have had huge numbers being involved, things like the holiday activity programme. Again, Amy knows I've taken part in a number of those, particularly at the Kindle, and we do get huge numbers. But I just am concerned that there's a mismatch, that the people who are coming along, the families particularly, who are coming along and involved in Talk Community, holiday programmes, or indeed the activities on the playing fields during the Queen's Baton relay, they're not connecting that with the wider offer that Talk Community has. They're not seeing as, I suspect if you ask quite a lot of people in my ward, they'd probably say, oh, Talk Community, yeah, they run, activities for the children during the school holidays. And that is fantastic and really valuable and really welcome. But there's not the connection between these people are also, or this service is also where I go to when I want information, when I want signposting to services. And I'm not sure what the answer is, but it does seem to me that some of the success stories, like the holiday activities programme, needs to be really blatantly, deliberately linked to this is what else we can do. And particularly because many of those families will be in those categories of the hard to reach people who actually do need signposting to services. Thank you, Chairman.
Thank you, Councillor Tillett. And again, good challenges, back into it. I think what I will say, obviously, what you will receive from the report, but actually we've had, from Talk Community perspective, notwithstanding, what Man's put in from information advice, we've seen a huge increase in terms of the number of people going to the website, in terms of Talk Community directory, 200% increase, and a huge increase in reach as well that we've received through social media platforms as well over the last sort of 12 to 18 months. So that is out there, but whether it's directly potentially those who are coming into adult social care, sometimes it's hard to correlate that information, but we are seeing an increase in reach through a number of our programmes, etc., through that online. We continuously with the Talk Community, certainly the holiday activity fund, like you said, it is a huge success. We continue to try to brand it, Talk Community, so people, but we give the information when people go out, when they register, it's all through the Talk Community website and directory, so they do need to go through that portal and the website to see that's where they need to register. So the volunteers there and things like that, they often are hubs, and so they are trained in that information. So we, as much as we possibly can, we are trying to connect it. But if what we absolutely want to do is that when people, before people actually need that support, obviously we want them to be able to either go to a hub or the website or somewhere that they can recognise that this is Talk Community, and that's where they can access that information. It's, like I said before, it is a continuously evolving position for us. We are trying, with minimal resource. I know, comment around finances today, but it is minimal resources going into this, and it is on the back of utilising volunteers and other access as well to try and grow this as much as we can, so we can get the information out to people. So yeah, I think all I would say is we are on that journey, and if the committee have got any ideas and suggestions in terms of how we can improve that or grow that, or make it slightly different in terms of our approach, I'm very happy to take those forward. Certainly, because you are as well in the community listening to people, so happy to.
See, because my concern is, you're quite right about the branding, but the problem is when you are just branding the holiday activity programme as Talk Community, for many people that is what you are, and it's almost as though that branding needs to be broader. Talk Community, a service to help you access service to access services. That's dreadful. That's why I've never worked in advertising. But you see what I mean?
Yeah.
I suspect for instance. That just sounds like an old supermarket, but that's me showing my age. A way to access local services, perhaps, I don't know. But as I say, for many of those families, for instance, who come to the Kindle, or through Riverside or through Hinton Community Centre, Talk Community equals holiday programme for the children, not all these other things that you have to offer. And somehow the branding needs to be broader, I think, perhaps, and make it clear that there's much more there.
I mean, I think it's a great challenge. I mean, we did the branding probably 18 months ago now, really. So, it's probably a good opportunity for us to kind of take a stock and look at it and review to say, actually, is it kind of, like you say, because Talk Community has evolved and developed quite rapidly as well in terms of these different programmes of work that we are doing, actually, are they quite rightly, as you say, are we connecting them out, and are people connecting them to each, to what actually the broader overarching approach is that we're trying to do through Talk Community. So I think it's a great suggestion. And we could certainly look to how test that branding out as well.
So presumably the holiday activity, which is, as you say, is well used, that's a point of access where a leaflet can be given out to say, well, we don't just do this, we do a bunch of other stuff, and here's all the other stuff that we do, and that way all the people that have accessed that service know that we do other stuff. So, something that we do.
Yeah, absolutely. Through all the different activities that we provide, we do offer. We make sure that everything, the breadth of what we offer is provided through each of the different offers. If that makes, I'm not sure if I described that very well.
So basically, every contact is presented with information about all the other things.
Yeah.
So it's slightly inexplicable as to why, as Councillor Tillett says, that there's not a universal awareness of it.
So I think, and also, I'll give you an example. We did the holiday activity day in December, which is a family day, open day at White Cross. So there, exactly, we've got Talk Community stands there. We've got Talk Community staff there. There is information, advice, and signposting there. So there is that kind of connection that and we are all opportunities where we're absolutely trying to make sure that people are aware of the wider.
Well, with respect, that's probably the exception rather than the rule. That's not typical of a holiday activity day, is it? You don't normally have a stands and a array.
No, we wouldn't have that normally. No, because it's the activity for the children. Yeah, but the volunteers and things like that are aware of Talk Community in terms of what's available as well. And so yeah, but
there is, for me, there's a danger in growing the resource ahead of the need, or ahead of the access to the resource. Because I have local ones that, to me, they've got very blessing ones. Warm space, they're heating their warm space. And I don't think anyone turned out apart from other volunteers that stand out in their warm space. But ultimately, that's corrosive, it's disheartening, and those volunteers will, because if the whole purpose of being somewhere, giving up the day, that is not, there's nobody needing it, or apparently needing it, or turning up, then clearly you'll just don't have it in the future, and that would be fair enough. So I think we have to be a bit careful about not growing the resource on the back of the enthusiastic volunteers. If actually the need is not there to make full use of it. I don't know how we calibrate that. But the other thing maybe was saying that I was thinking about the sort of the model in charity shops, which is broadly voluntary based, but there's often a person that isn't. and it's that kind of mix and match that gives sustainability for, you know, the ebbing and flowing of volunteers, and means that something will be able to go on for longer. Do we consider that as a potential way of just making sure that we have somebody that goes in and supports from time to time, or especially, you know, as some of the hubs get busier, that there's a professional presence there, as you would get with a shop manager in a charity shop, you know, just to support the activity. So that's one question. I had an idea about the holiday activity stuff, which is great, but because it's not entirely unrelated to the whole self-funding argument, that if we focus all our efforts on a particular cohort, then that particular cohort will become, as it were, separated from everybody else. And it would be really good if we could get a universal offer, but find a way of you know, payment or whatever being different for different people within that. So we continue with a mix, particularly with young people. I kind of feeling it's better for them to be in a social mix than to be in a, you know, specific group in terms of their life experience. So do we have a sense of that around the holiday activity work? And the other point that I was going to make, which is about that, there's a curious relationship in my mind between both the volunteer and the person whose need is being met, because there's also a need in that, and that altruism is a great thing, you know, in terms of mental health and well-being. Altruistic activity is fabulous for both of these elements. So in essence, you might go in with the, you know, needing something, but in fact that need might be met by becoming a volunteer. And do we have that kind of dynamic within the hubs?
Okay, so a few questions there. In terms of the paid member of the model around potential opportunities around the paid member of staff. So some of the hubs that we've already got are already, you know, organised at their businesses. So we've got things like, we did have the Life and Soul Kitchen, which at the moment unfortunately not around. So they've got paid members of staff there, and there is also in the city Flip Out, for example. So we do have a mixture in terms of how it's run, and the idea and the model that we've got in terms of the structure of support is that through the Talk Community Development Officers, they should be going and providing support to the hubs to see, you know, if they want to grow, if they want to develop, want additional funding, you know, they are there to provide that additional support in terms of how and advice with and to work with them. One of the other models, as well as I think most of you know, we are looking at the super hub / enhanced hub model. So we've got some capital funding that's in the budget to allow us to enhance hubs through capital funding, so that, you know, so hubs may want to increase the footfall, the footprint around potentially having a cafe or another room. And we're just looking at that at the moment in terms of actually what is the essential criteria that we would expect from an enhancer or super hub, and then the kind of added on value. So that might be, for example, we'd expect them to provide news services or you know, some sort of kind of outreach provision, or absolutely opportunities for our social care and our health colleagues to be able to go in there to be able to have more accessibility into the community. So so there is that kind of model as well that we're just working through at the moment through the super hub / enhanced hub route. In terms of the holiday activity fund, it is a mixed. It isn't segregated. So what we'll often do is pay for the activities for those children who are going as part of the holiday activity fund, as part of that group and that activity. Some are specific for the holiday activity fund, but the majority are through, you know, for example, Paces at you know, that provide the football will pay for the spaces, but then there is the one paid for places by families that are in part of that. I think I've explained that right. No, not right, but I think that's clear in terms.
That's really good to know.
Part of, yeah, it's part of the wider sort of offer. It's the offer's on, and then we'll pay for certain spaces and places on that. But there are some specific for the holiday activity fund for those individuals as well. So it is a bit of a mix.
So mainly,
yeah.
Okay,
yeah.
Right. So sorry, the 200% increase on hits to TT website.
Yeah.
numbers as well as a percentage would be useful there.
Yeah, so we've gone from just over 3,000 a month to just over 12,000 a month on the website.
From 3,000 to 12,000. That's substantial. Wow.
Yeah, so
More than that.
yeah, and some months we peak, you know, so generally in the summer, we peaked in terms of that because people are going to the holiday activity fund, but what we are seeing now is the main ones are things like the holiday activity fund, Money on Your Mind page, but also have information advice around health and wellbeing as well. And we are seeing a month-on-month increase as well.
Could you tell us what the orange line is?
Yeah.
It does say, it says number, oh, you haven't got it. It's got number.
So that the orange line is actually the number of events that we put on that go onto the
number of events from the page
onto the
or a
website.
different page. Anyway, no,
on social media,
on
followers.
social media.
Yeah, so that's the number of followers that we are having receiving on social media platforms. So that'd be Instagram, Facebook, and Twitter. Final question. Oh, I've lost my train of thought now.
Altruism.
Sorry.
The other point I was making is about
Oh,
altruism.
sorry. Yes, sorry. I mean, obviously there is evidence that people who do volunteer, obviously that helps them in terms of supporting their mental health and their well-being, as well as hopefully getting into employment as well. So I have to say we don't kind of monitor that at the moment, or I understand that numbers, but you know, again, what we're trying to do is work with these communities, so we don't have a kind of commissioned relationship with them. It's more of a collaborative working relationship with them. So we don't expect them to give us lots and lots of information, and that's often hard then to balance that.
For me, you kind of think you talk community is, if we look at it down one end of the telescope, saying we're providing access to services for people who but actually the volunteers themselves are deriving a benefit from it. So that it's it's entirely beneficial.
Yeah, absolutely. Yeah,
and we need to underemphasise that.
Completely agree. Yeah, and what we have found is, and I recognise your comment on the warm hubs as well, and that was almost like a bit of a test to see and pilot to see actually if they're needed. Obviously, we had a space. I know we're in a quite cold period now, but before Christmas it wasn't that cold. Yeah, no. So, but we have got a number of warm spaces who are seeing a huge number of footfall, and we've got some great case studies. So one individual started to attend the warm space, and now they are a volunteer because they've seen how it can support. So there is a lot of case studies that sit behind the work that we do to demonstrate actually some of the great impact that is happening. But obviously we just want to grow that and expand that as much as
into work. But it's good to know. I mean, that's why it's nice to sort of have this exchange and hear about that, because it makes it very real and worthwhile. So I'm grateful for that. The other thing I just wanted to make is that on the existing recommendation C, review of community broker and broker function. The other thing that I'm kind of interested in is the relationship between talk community broker, social prescribing, recovery college. There seems to be a number of areas of activity which are similar, or they would align very well, and I'm not sure that they are aligned, I think is what I'm getting at here.
So I suppose there's a couple of responses to that. We work very closely with the primary care network. So our teams, like Mandy's teams, are on the primary care network footprint, so to enable them to work closely with the social prescribers and health and wellbeing coaches. But there is obviously a national directory from government, from a health perspective, they do bring out these additional roles, such as the social prescribers, the wellbeing trainers, workers, and things like that. So we are working really closely at the moment with tourists in particular, to say actually we do need to review those functions and those roles in the community to ensure that we are absolutely maximising the resource that we've got. And also, what's that front door as well? What does that front door look like for us across the system for a kind of a community front door? So within Talk Community, I've also got customer services as well. And obviously, there's the PwC work that's going on at the moment around customer services review. But actually, how does that all link in together as well? We have got a lot of roles and functions in those communities. So, and no doubt there is duplication going on. So we are just going to kick off a piece of work now to review them, review the roles, review the functions, and say what is it we need. and where do we need them, and make sure we are maximising that as much as we possibly can. Because it is recognised that there are a lot of roles. I mean, it is slightly difficult because there is a national directive, like I say, from government to health to say you can have these additional roles, but it should be based on local need. So that is a piece of work that we're committed, and Hilary and I are committed to doing and undertaking with Matt, actually with support from Matt and his team.
And the other, just finally, this is a bit of a jump over to a different track. Heritage residents living on the Welsh border. I note in the report that there is now a Paris social work presence in the integrated discharge team for Paris residents. Okay, so that obviously begs the question whether we have a Herefordshire social worker in the discharge team at Neville Hall, or
from Herefordshire, no.
So in other words, is there equal and opposite?
No. There isn't, but numbers wouldn't indicate that there is a need. But what we do have is a formalised discharge to assess process from other hospitals in surrounding areas and community hospitals as well, so that there is a pathway that's only recently been devised, but for people that need in to go directly to a transfer to a community hospital bed, because there's still a need for some input from the community hospital. All referrals for discharges from out of area go into the hospital discharge team, and then those that aren't needing a transfer into that bed will are then with the discharge team to take forward a discharge to assess. So there is a absolute route for that now. So there's much better discussion points and pick-up points for people that are out of area in hospital.
Right, okay. Out of area, including different country.
Yes, yeah. We also have, as we call it, a Monday system meeting every Monday, and Paris, for example, and any other local authority or health. That's across the border in Wales or Gloucester, Worcester, can link into that meeting and talk about anybody that's stuck or there's problems with any parts of the discharge. So it's developing.
So supposing one of my local residents was in Neville Hall before they were discharged, we would be engaged with that process.
Absolutely.
That is a change. Okay. Good to know.
I'm not saying it's perfect, but the plan is in place.
There we go. Right, do any members of the committee have any other points that you wish to raise at this time? Okay.
Like the census result just showed the extraordinary amount of free care that it's provided, and I know we aren't able to provide that much support to them, but it is the most phenomenal amount, isn't it? Above 20 hours and then above 50 hours a week. And I don't know whether we have whether they're meant to go through to a community like everyone else, or whether we do have anything that goes, hello, if you're caring, here's a little flag to follow.
Yeah, so obviously Talk Community is available to all ages and all people who are supporting and those with disabilities, or everybody really. But we specifically have carer services through the council that we commission as well as that are available to, and are available to access carer services as well.
So would you just find them on our normal website?
It's on the directory, yes, as well.
And on the Talk Community directory. Thank you.
Right. So thank you very much for a good report. Really good, interesting and well-written report. So I'm going to ask if any attending cabinet members, council officers, or other participants wish to make any further comments. Councillor Crockett.
Thanks again, Chair. First of all, I think thank Amy for this overview, and I think it is really important that we take from that it is acknowledging that there are additional areas and opportunities that we're going to look at. The second point, I think, which probably will help Amy, is that it's 18 months into the programme and she's considering a refresh, a rethink, and see where we can go from here. It's really important that we acknowledge that the enhanced hubs, if they are going to be enhanced, they have to have a business plan prior to their application to come and have additional costs and additional facilities at those hubs. And I'd just like to thank Councillor Tillett for his ongoing interest, commitment and work with our service director and the team to provide a really good service, especially, I don't want to mention your ward, every ward should have a councillor like you that can really commit to it. But thank you, Councillor Tillett.
Just trying to soften me up.
Sounded like a party political broadcast and it's not, I'm sorry.
Thank you.
Thank you.
Councillor Tyler, do you want to comment at this point?
Thank you, Chair. Just reiterating what Councillor Crockett has said, I think the importance of hubs at the moment, and I'm very active in my community, and all I can say to members is that the more we can engage with our community, support our residents and signpost, it will be. And you know, I would always advocate that the more we can support, the better. And I really do want the hubs to accelerate in what their delivery and services will be over the next 18 months. It's a transformational programme, and everything we can do to support our residents is so hugely important. Thank you.
Thank you very much, Councillor Tyler. So we move on to recommendations. I have recommendations before you in the agenda. I think one or two on screen.
So, Chair, I think all of the recommendations as set out in the report have been agreed with, just the potential for a slight enhancement to recommendation C, which is to include social prescribing, wellbeing trainers and other elements within that review. Similarly, recommendation E, just add the additional text of and other networks, as well as the primary care. And then there were two additional recommendations, so to provide or target advice to self-funders so that they are enabled to take timely interventions in connection to their own health and wellbeing needs. And then, bear with me. Pilot error. And then finally, a recommendation was information being provided from time to time to those people with community referrals who do not need full care assessments to find out if they followed up referrals, they received a service, and or found that helpful.
Is information provided to the service user or about? I understood it to be a kind of a dip test of outcomes.
Well, I was just thinking logically that if 71% of people didn't need an assessment, they were told to do something. So I thought, well, we might as well know, did they follow it up? Did they get a service? And, I mean, it just seems that even if they followed it up, I mean, the key question is, was it useful?
So maybe it's information about those people.
Anyway, the word,
that's all.
yes, I'm sure that's my guess, because my brain is scrambled. Yes, that looks great.
Let's go with that then.
Well, it looks shorter, which is great.
That's correct.
Can I go back to social prescribing, please?
Yes.
John, like to go up to page. I thought it was
Good on page.
Okay, I think we need to put something in there about Maylord orchards and other council assets that might be useful in that. For example, the library, we have a new library going in possibly. I think talk community should be in there. We should be looking at different other areas in Maylord for social prescribing, because that's what it was intended for. So I think we need to name something in there, not just put a general social prescribing.
I think what I'm going to suggest, Councillor Summers, is that we leave the recommendation as it stands, And we'll put a note in suggestions stroke observations
Okay.
that
We need to use-
Maydell Orchards is considered as a point of provision of service.
But it is officially, it was supposed to be for social prescribing anyway. But not just that, we need to start making use of our assets, which are in disrepair right now. So perhaps if we start looking at them for something, maybe they'll come along again and be useful. Because a lot of the stuff in Herefordshire right now is of no value because it just needs too much repair. So I think if we're looking at social prescribing in general, we need to look at the whole council asset. Anyway, that's my feeling. Because that's what most of a lot of the assets are for, is for social prescribing.
Suggestions, observations, department. Because otherwise we would be looking at mail order and then we're not looking at,
other ones,
any number of hundreds of other.
That's what I'm saying.
Social prescribing, everything from going to a dance class.
Assets have to be for the betterment of the residents, and therefore, and that's to do with social
We
prescribing.
can't narrow it down in the recommendation, but I think we could put something about that the council explores the use of Maydell Orchards for social and health benefits.
Yeah, that's fine. It's something I think we have to look at, because social prescribing is the thing at the moment and will be for the next so many years. So I think we really need to start making use of what we have instead of looking further afield.
See that then. There'll be a suggestion, the council explores the use of its assets, including Maydell Orchards, e.g. Maydell Orchards. Right, okay, good. Fabulous, great set of recommendations, suggestions. And as a committee, broadly content with that? Yeah, okay, so, are there any other comments from anyone before I put it to the vote? No, all right, can I have a proposer and seconder? Proposer, councillor Summers, seconder, councillor Gandy. All in favour, please show. Yes, thank you very much. Thank you all very much for your contribution. So we're now moving on to the work programme.
I mean, it might actually have to.
All right. I'll be quick then. Okay, so agenda item 9, which is the work programme. Work programme for the committee is provided in the agenda pack, agenda pages 77 to 84. This identifies the items of the next meeting, 6th of March 2023, referenced on agenda page 81 as being domiciliary and residential care in Herefordshire and perinatal care. There are a few items to be rescheduled as part of future work programming, which is the healthcare services update, Q&A, Project Brave, homelessness, and a couple of items have suggested for future scrutiny, which is access to acute hospital services, technology-enabled living. In fact, it could be slightly broader, couldn't it? Acute services generally, potentially. And then we were discussing
Social
earlier
housing.
about housing.
Yes.
So, right, so any comments from members of the committee about that?
I think we need to look at it, just
Housing.
generally, because we haven't in quite some time from my memory.
Yeah.
And it is a bugbear, especially with finances the way they are. People are really suffering, so we really
So
need to
we're
make sure.
talking about a piece of work around housing and health impacts.
Yeah.
Health impacts of housing, yeah. So.
Much the same as you do with poetry.
Yeah, well, that was, health impacts, poultry, not poetry.
Okay.
But that was a task and finish, so we're looking at a task and finish or a spotlight review, or.
I think a spotlight review to start with, and if it generates anything else after that.
Okay.
Could I just clarify about the perinatal care? Is that literally just about healthcare, or is it sort of generally about the readiness of someone to realise that actually someone is arriving and that various, you know, practical things need to be in place. I'm just keen that it isn't entirely focused on to be truthful, I'm very vague about what perinatal means, Councillor Crockett. Does it include that just sort of wider arrival of new person, a rearrangement of domestic routines, you know, getting off onto a, you know, the right leg for the first 3 years? I have no idea.
I think I missed some of that, Councillor Marsh, I'm sorry, but acoustics aren't great in this room. But I think this really is a follow-up from Councillor Summers and my input from the perinatal mental health group, that we weren't getting some answers from them regarding their service and their delivery. So what I think we need to do is to get Jenny Dalloway back to show us where that service has gone and where it's improved. And again, we can just ask them some questions relating to their performance.
I think they got further funding, and we need to know what's being done with that. They're not very forthcoming, to be frank, and never have been. It's taken us, what, 4 years to get a little bit out of them, so.
Yeah, so basically we want clarity on their service.
Yeah, it's going back to where we're going now with prevention, I think.
Yes. Right. Could we particularly ask them how they link up, where there are other problems that aren't their very tight thing, how do they signpost? That would be helpful to know.
Yeah, well, they have quite a big team. They have a midwifery team, they have a health visiting team that they liaise with. So again, they will be able to expand on their role and who they bring into their meetings.
So anyone got any other points about the March capacity?
I haven't really about the March meeting, but
yes,
on one of the rescheduled items, you've got Project Brain.
Yes.
And there's to be a presentation, member consultation or something in the next few weeks on that anyway. I don't know whether you want to.
Yes, we'll be getting, as it were, updated down.
Yeah.
I think I would probably say the healthcare services update that needs to be, needs to be kept on.
Yes.
And we've had the written updates on dementia and minor injuries, and I think we might consider that in March, whether we want to do anything else about that. Access to acute hospital services, I think that's got to stay on, but I do think we want to look at housing. So is there a particular feeling of when, do we want to bring anything forward, or?
Do we have to look at getting permission from March 6th? We're in Purdue just about.
Yeah, I think,
Will it make any difference to us, John?
Well,
we've looked at another scrutiny too, that we need to make sure.
Yeah, I mean, I think we'll.
So the expectation is during pre-election period, we will continue business as usual, but we will need to just look on a case-by-case basis on items that come up.
That's what I meant.
Yeah, we might need to discuss that a bit more outside the meeting. Yeah, I think if I could ask officers to take those broad subjects and then and see, where the natural timelines might flow. That would make more sense than us sort of randomly picking dates right here and now. So that's going to be my suggestion there. So the recommendation is that, subject to any further updates made by the committee, the work plan for the committee be noted.
I assume that the typos on the 6th of March will just automatically be corrected. I think, of course, the deadlines being last year probably were not met in that case.
Yes, it got moved. Yeah. Oh no, right, it's okay. Yeah, 22. Yeah, wrong pages.
16th and
This is when we change it. It's very confusing. Yeah.
And you criticised me for having a computer that was an hour out, and we've got a year out.
We were just saying that.
We've added homes, haven't we, to the potential future activities.
Yeah.
Certainly for future consideration of the roadmap, absolutely, make sure that's on there.
Housing.
And so it depends on how much we can get through by the end of the municipal year and members' availability and all the rest of it. So it's, we'll certainly add it to it.
At least it could.
Okay, so we
Put it on the shopping list, yeah.
Yeah, we've got it on the shopping list. So, so can I have a proposer and seconder? Thank you, Councillor Summers, Councillor Tillett. Which only leaves agenda item 10, date of the next meeting. The next scheduled meeting is Monday, the 6th of March, 2023. At 10 AM. Thank you all very much for your attendance.